It's 3:10. Dr. Campbell here. Want a couple quick reminders about class, and I'm going to do a quick little micro lecture on planes and axes. Um, so I'm coming back on Wednesday, but it's going to be late. If I drop my plane and axis within. All right. So class Wednesday will be review with Lindsay. She said nobody should know it's today, but just fine. It's a supplement. It's meant to be there for extra help, questions, clarifications about content. So you guys need to kind of be proactive if you need help. I do want to reemphasize, please watch the lectures, the posted lectures. Um, don't wait. That's just, if you wait till the last minute, all that stuff gets super confused. Okay. So today, what I want to emphasize is on your commandments, objects rotate in planes, and they rotate about an axis. Okay. So what we know about straight line motion, like the XYZ axis. So here's the X, and I can go this way or that way, positive, negative. Here's the Y, I can go this way or that way, positive, negative. Here's the Z, right at you. But we don't use it for joint rotations or motions from a straight line. We use the axis, fixed points about which things can rotate about. So in other words, the x-axis, things can spin in the sagittal plane. About the Z or about the AP, the anterior posterior objects can rotate in the frontal plane. About the polar objects can rotate the transverse plane, right? So axes serve as fixed points about which spin can happen, like if I spun a basketball transverse. So that's how you have to think of it. Some people get to the, some people see it better by seeing spin. So in other words, it's easier. Let's say I take my cell phone. I see frontal spin, sagittal spin, or transverse spin. I could even have the phone like this: sagittal spin, transverse spin, frontal spin. I see spin. This is my sagittal, frontal, transverse. In the videos, I talk about how there's three ways someone can rotate. They could do like a front roll, back roll, sagittal, cartwheel to the right, cartwheel to the left. That's frontal, and then spin to the right, spin to the left. That's transverse. So sagittal plane rotations, spins, or joint motions are going to occur about bilateral axis. And these axes are all, the axis are the fixed points. And those have like descriptive nature to them as well. So like a side to side axis goes in one side out the other. Bilateral axis, sagittal spin. An axis, a fixed point that's going to come in from the front to the back. Anterior, posterior. From the anterior to the posterior, from the front to the back. Right? So anterior, posterior axis is great for frontal plane rotation. So frontal plane rotations occur about an anterior, posterior axis. Sagittal plane rotations occur about a bilateral axis. And then transverse plane rotations occur about a polar axis. Polar, or the pole, south polar. Where it gets somewhat confusing is perspective, relative, absolute, local, global. I think I used the analogy like relative VO2 relative to body weight, right? Body mass index relative to body weight. So it's the same with human movement. We have global references, like in the classroom, the front and the back of the class would be like the anterior, posterior axis classroom. That doesn't change. The front of class is always the front of class. If I pointed to the front of class and I looked to my right, that's not the front of class. That's the front of class. No matter how I'm looking, that's still the front of class. But my front matters how I'm looking. I'm looking to my front. Now I'm looking to my front. So the planes and axes move with me because remember, human movement is about the perspective of the person who's moving, you're analyzing. And so planes and axes move with the joints. So if my wrist has a front and a back, right? So like that's the front to the back of my wrist. So that's the anterior posterior of my wrist. This is still the anterior posterior of my wrist. This is still the anterior posterior of my wrist. Does that make sense? So anterior posterior axis is going to have frontal planes rotation, the side to side, the medial to the lateral, side to side of my wrist. It's a bilateral axis. Sagittal plane rotation. This is still the bilateral axis of my wrist because it moves with me. Sagittal rotation. This is still the bilateral axis of my wrist. Sagittal rotation. So to summarize, the wrist can move in all three global planes. The rooms transverse, the room sagittal, the room frontal. But the wrist can only move in like its sagittal plane, one of its sagittal. I'm going to teach you when we get into the wrist about the front, and there's no transverse. But for the first test, it's all about sagittal front. One more point about this short video. One more point about this. The reason it's important to understand local references is so that on the test, I don't say it's, or in class, I said it's this, and you say flexion extension, it would be a lot of it. On the test, I might move it globally here. And I don't want you to say ab and adduction, because this is just as much flexion and extension as this. I don't want you to say transverse rotation. The wrist is doing the exact same thing. It's like, dude, I'm flexing, extending, flexing, extending, flexing, extending, flex, extend, flex, extend, flex, extend, flex, extend, flex, extend. That makes sense? So we don't use local references to talk about local referenced topics like joint motion. We can't use global. It has to be local to the joint. All right, guys. Hope this was helpful. Y'all take care. We'll see you soon.